Welcome to the Daily Apple. I'm your host, Kevin White. Emma Ryan and I will dive into all topics related to the science of longevity, along with some other subjects we just find of interest, with the hopes to provide useful information for everyone. This stems from my personal interest to optimize the human condition, to not just live longer, but to live better. Okay, hey, Echo. How you doing?
Hi, good. How are you doing?
Welcome back to the Daily Apple. Today, really, what would make a young mom of four leave a comfortable life in the U.S., move to a rural African nation, build and literally, from the ground up, one of the most advanced healthcare systems on the continent, and why, in her right mind, what would keep her going when the pressure comes, not just from the needs of the people, but from the outside forces that want her to fail. And we're talking corruption, organized crime, even threats to the mission and their lives. Today, on this episode, I'm joined by Echo VanderWal, the heart and co-founder behind the Luke Commission, which has delivered over 1.5 million visits in Eswatini, transforming care with faith, grit, and innovation. From running mobile clinics out of a barn, am I right, to building Africa's largest oxygen plant and deploying national drone networks, Echo's story and Harry, her husband, will challenge how you think about calling, courage, and what one life can truly accomplish. So, whether you're in medicine, leadership, or just searching for purpose, this one will stick with you. So I am really stoked to have you here, Echo, and I really appreciate you making time. Since the first time I met you, I thought you were just a rare breed and truly salt of the earth and doing cool things. And really, I had no idea why in your right mind you and Harry would leave the United States to go do what you're doing. And I was full of questions at that time. And I continued to just scratch my head about, how you guys do what you do. But I mean, in context, really, you're a PA. Harry is an MD. You guys both graduated top of the line. He was AOA. You guys could have done anything you wanted to do. I mean, lived a comfortable life here in the US, and you just uprooted and had an experience over there and just changed the trajectory of your life. And anyway, but yeah, so I'm just excited to have you here. You're just a cool person.
Thanks, Kevin.
Yeah.
Thanks for having me. I appreciate it.
Yeah. So, yeah, I met you back. My first experience over there was in 2012, like we were talking about. And one of the days I was with our friend, Dr. Paul Rothwell, Ed Overholt, pediatric cardiologist, and John Williams, cardiologist here. And I remember at that time, you guys were in mobile units, and my experience around missions, and as a doctor, you'll go over there occasionally and, you'll work for a while and then you'll leave. But you guys had a really well-oiled machine even at that time. You were mobile units. The way you thought about it and the way you approached it was much different than anything I'd ever seen. And so I want to kind of talk about that for a while. And I remember you were just, I don't know, are you a tomboy or something? Because you were just in there and just executing. So tell me about that. Do you remember that time whenever we showed up and you
I
were?
remember when you were there. You were a bright light. There's a lot of people that come and visit, but you were a bright light. I could tell you were seeing things maybe you hadn't seen before, seeing things done in a way you haven't seen them before. Well, we are also seeing things in a way we haven't seen them before either. I mean, we've just tried to take every day at a time and learn every day and pivot, small pivots every day, and figure out how better ways to reach the most vulnerable. And it's been very fulfilling. We've been here for 20 years now, so I guess you were here about at midpoint for us.
Yeah.
But yeah, it's been very fulfilling, deeply fulfilling. Well, as you've mentioned, there have been challenges and struggles. I'm reminded that a life worth living has to be a life worth dying for. So I think we've maybe seen that a few times in our life here.
Yeah.
And it's exhilarating. You have to pace and make sure you don't take it all too fast, but it's been really great.
So let me get to one of the things that really struck me from you guys, because as a physician, there's a lot of us in the United States that'll go over and spend a week here or there and all this, and you'll wrap up shop around maybe 6 or 7 or 8 p.m. But one of the things that struck me about you guys is there was so much thoughtfulness that went into, if we're going to help these people, then it's got to be, we've got to build their trust. We've got to think about, really embedding ourselves in there. And so one of the things that struck me is like, wait, you guys don't leave until everyone is seen. I mean, whenever you go out to these locations, you'd stay till 2 or 3 in the morning. Your kids would be falling asleep and wherever, and you just wouldn't leave until everybody was seen, because it meant so much to you. People traveled to whatever location you were at, and you guys were closing, then that just build, where's the trust there? So there's so many things to hit on here, but I just, that blew me away. I thought, whoa, that's really something. So anyway, where did that come from? Why did you?
It was very, very early on that I think what really helped us is for the first 8 years, we weren't really that big. Initially, Harry and I were the only medical people. We worked with a team of 20. We know every rural area in the country, and getting our feet on the ground and really hearing, not just your feet, but your ears, and really hearing what are the barriers to care? Why are people not accessing care? Which most of the time people would say, if I have to be treated like that, let me go home and die, when they were going to other facilities. So you realized how critical compassion was. And I think compassion is very closely tied to trust. And if a person waits all day for healthcare, and then just because you're tired, you close the door, that really does
Mm-hmm,
break the trust. And the whole foundation of compassion crumbles.
mm-hmm,
So, obviously at times you had to dig deep, but to be honest with you, when we think back on those days, years, it really, there's like this supernatural strength that you get, and you just power through it. And then at the end, you're like, wow, that was awesome. You go home, you sleep, you're really tired, but it's a good tired. And we learned so much during those years. And I really believe that what has held us together all these years is the trust that was built in the early years. Why did we do it at first? It was purely two reasons. One, it costs money to deploy. Once you spend the money on fuel and other things, you don't get it back when you run back and like there's just an
mm-hmm,
efficiency you're trying to keep intact there. But the main reason is because if people come and wait all that time and then you shut the door on them, will they come back again? And if
mm-hmm,
they don't, what will happen to their health care? Will they die because you didn't diagnose something? And will they then leave behind many orphans? So
mm-hmm,
those were very real issues, especially when we first came, that people were struggling to access care. Of course, working in the country with the highest HIV rate in the world. And during that period, the international agencies were saying that if something drastic didn't change by the year 2050, Eswatini would be considered statistically extinct. Well, if that's not enough to drive you, I don't know what is. And I'll be honest with you that, people thought we were crazy out there with our kids and everything, but reflecting now back on 20 years, all of our kids are involved now in the work here, and they're doing it from their own sense of calling. And I believe what they saw when they were young, and also having boots on the ground with us, really helped to define and embed a calling of their own in them. And I really believe, Kevin, at the end of the day, it's how do you want to be treated? And even
mm-hmm,
if you look at our name badges, it says treat every last one as your father, mother, brother, sister, or child. And when you're working in a low resource environment where there are a lot of challenges, unique challenges, you do have to have something that you hold on to, and that is your
mm-hmm,
foundation. And for us, it's been taking care of people like our own family member. And that has just really helped to guide us when there's difficult decisions to be made. So I would say those were the driving reasons as to why we stayed late. And to be honest with you, it was invigorating. You look back and you realize that you didn't leave anybody going home empty handed with broken hearts or broken hope. That
yeah,
there's something fulfilling in that.
yeah. Um, I guess I do want to get a few things. I guess it's important to say, anybody who's not familiar with Eswatini, or, you know, previously Swaziland, but now Eswatini is that was one of the most heavy hit countries from the AIDS pandemic. Is that safe to is that right? Like per capita, the most
We
people
have the highest HIV
affected?
prevalence rate in the world.
Yeah.
And as I mentioned, there were really alarming statistic trajectories that were being looked
Hmm.
at globally. And
Hmm.
during the worst of the HIV crisis, 20% of our nation became orphaned. So
Hmm.
there was and still is a lot of pain as a result of what happened during the height of the HIV crisis.
Yeah. Uh, that was something that struck me at the time was, there's a lot of kids. I mean, where are all the parents? And you were like, they're dead. They're gone. We got a whole slew of orphans. And I mean, there would still be, one of the biggest stores along, the different streets would be, coffins and stuff like that. People still at that time still dying. And, I guess I'm getting it. I do this. I get ahead of myself and I don't go with the timeline, but I do want to hit back up a little bit to you got this calling, and I don't want to spend too much time on this because we got to be respectful of your time, but because I can get lost in this. But you're 8 years old and you decide, I want to be in missions. You felt that at 8 years old. Is that right? Am I
Yeah,
remembering that correctly?
I do. That's exactly what happened. At 8 years old, I felt like I was called to work overseas in healthcare. And I told my parents, thank goodness they didn't make fun of me. They always supported me. They were always the sky's the limit. Do whatever God wants you to do. Yes, people made fun of me even when I was a kid. How could I know at 8 years old what I wanted to do? But I do believe it doesn't happen for everyone, and that's fine if it doesn't. But for me, it did.
Yeah.
And then Harry, when he was 17, we met when we were 19.
Hmm.
And to be frank with you, honestly, at first we were like, oh, well, we want to do the same thing. And there's very few people who want to do this. So I think we kind of fell in love with that. But, we got married then when we were 21, and Harry went to medical school and I went to PA school. And
Hmm.
it's been a ride, that's for sure. And I'm really grateful that my parents stoked the fire. They didn't ever put water on the fire. And that really allowed me to dream and think outside of the box as a kid. And I really enjoy even now being around kids, and letting them talk about their dreams. And even at the
Yeah.
campus, you mentioned, that we're flying drones. And we did the drone launch. We invited all the local schools from around. Why? You just want kids to be able to experience innovation. You want kids to be able to experience things that are bigger than themselves and
Yeah.
things that they've never seen before, because I think that sparks something in them. So I'm really grateful for the people that invested in me as a kid. I can remember several, in particular, men who used to talk to me like an adult when I was a teenager. And those are all things that encourage you, because it just makes you realize someone's taking you seriously and taking your dreams seriously. And so I think that kids can, at a very young age, know what they want to do. And in my experience, that's what happened.
And then you and Harry, how did you guys end up in '04? You were just visiting there or something, and that's where you kind of the light bulb went on that, hey, this is where we need to be. And is that am I getting that correct?
Yes. So when Harry and I married, and then he went to medical school. I went to PA school, and when he was in residency, one of our friends gave us the name of some people in Eswatini, and we didn't even have passports at the time. We got our passports for that trip. That was our first stamps in our passport, and we came to Eswatini and dropped literally into the middle of the worst of the HIV crisis at the height. They took us straight to a rural area. Everywhere we went, people were dying in every single house, young people between 20s and 40s. It was really shocking because all the other disease I think that we had ever been exposed to is mostly older people that are dying. You don't see young people dying. And to see
Yeah.
young people dying in the way that they were dying was very shocking. And so Harry was about halfway done his residency at the time. We had a 2-month-old baby with us, our number 4, and we just knew that's where we were supposed to come back to after he got done. So once he finished residency, the next month after he took his boards, the month after he finished residency, and then the next month we came over to Eswatini, and this has been our life since then.
You know, it just that's still so we're about the same age and everything. So at the time you're getting through with education, you got this big, most of us have this large, and even now it's even more as far as debt. and you're just looking forward to a job that you can do what you like to do and get paid to do it and start, living pseudo comfortable life and start paying off your debt. But no, you guys are like, you know what? Let's just go over here and handle this AIDS pandemic and just go where we feel called. I mean, that's just really supernatural kind of stuff in my mind. And I still scratch my head at that, but I just really respect you guys for that. And Harry's, you guys have this laid back. I mean, your first set of kids were triplets, and I've heard you say, quote him and saying, we can either enjoy or complain about this because it's just the same amount of work. So,
Yeah, then you said it's all our attitude. That was a big that was a big foundational piece of the beginning of our marriages. Our attitude will determine where we go in this life. And I think
yeah,
just having the triplets prepared us for the work that was here, because yeah, it's overwhelming when a nation is dying from a disease, especially a disease
yeah,
like HIV. But it is also very fulfilling when you
hmm,
just put one foot in the front of the next, day after day after day, and really you start to win the trust of the people. You start to be
yeah,
trusted, and people start to come earlier for care and feel more at ease in seeking care. And those are all things that really are fulfilling. But as far as the loans, we actually, after we worked here for 10 years, got qualified for the public loan forgiveness program in the United States. So we actually got
cool,
our loans forgiven after 10 years. Now, when we came here, Kevin, we didn't know that was going to happen. So we call it blind steps of faith. Yeah,
yeah,
we leaped off the cliff and like, here we go, let's go, free fall. But I can tell you right now that there's that none of those free falls do we resent or
yeah,
ever harmed us, if I can put it that way. We've always been really blessed, and even the public loan forgiveness program from the United States government was a blessing. It allows us to focus more here, and so we're really
yeah.
grateful for those different programs that have been there along the way to just allow us to more freely serve the people that God's called us to.
And I do want to talk about, that original setup. So whenever I saw you in 12, the initial time, I was really impressed by the way the whole idea was to treat HIV and just kind of minister to these people's souls kind of thing. But to get them there, the culture of the people, and I still can't wrap my head around some of this stuff. One thing that I found is, one, the compassion level is different with the people. And then two, there's a stigma around treating HIV at the time. I don't know if that still exists or not, but where people wouldn't seek out treatment. So men would, and the way they treated it and thought about it. So they wouldn't, like if you went and said, hey, we got an HIV clinic, they don't, people aren't going to come in droves because they don't want other people to know. And it's,
Even
if they
today,
have
it's the
HIV, they're
same.
labeled as such. And so it was just really impressive. What the word I'm looking for, just clever about treating that. So you'd have a medical clinic where a guy could come in and have his ankle looked at or whatever. And hey, by the way, and you test him for HIV or whatever. But it would be, even the way you communicated that with them was very specific and kept their privacy intact. So you could treat the HIV, and it was just a clever way over the years to kind of take care of that pandemic and get that going. And it was just really thoughtful with the patient in mind. You know, Whenever I go over, you just go over there and, blanket a treatment or whatever, and it's just not really well thought of. And I thought how that was so accurate in the way you took care of that. So anyway, I just wanted to comment on that. Do you have anything to say about that? It was just the way you shuffled people through and just kept their dignity intact. I was just impressed with the whole system. And that was the simple system. It's gotten crazy techie right now. So you're living in the future now, but we'll get to that in a
Yeah,
minute.
it's always nice to talk to people who were there in the early days. But we just realized when we first came, there was no treatment for HIV. There are no antiretrovirals. So when you're in a
Yeah.
country where you can tell people are dying from HIV, and frankly, all the disease is masked by HIV. So the things that you would normally see, you don't see them because HIV is kind of the overarching issue that's masking everything else. And so we decided early on that we're just going to build trust and show compassion and love build relationships. And when the testing kits came for HIV into the country, initially we had like a separate room for testing for one day. And
Hmm.
that's, I think, what you saw is that when we would go out into the field and do things, we were very intentional about watching the behaviors and how people reacted to certain things that we did. So we realized that, oh, when you have HIV testing in its own room, people don't go there. So
Hmm.
the next day that we went out, we actually put HIV testing with where you got your blood pressure and your blood sugar taken. And everybody was willing to do it because it was just part of going to see the doctor. In fact, the first day when we had it isolated by itself, we tested 30 people a day. The next day we tested 90 people a day. It was very indicative that people were much more comfortable with it being integrated. And
Hmm.
at the height, we were testing 250 people positive a day. When I say that, it almost overwhelms me. But we were there and we did it. And there wasn't enough antiretrovirals to start everyone on treatment. So you would have to pick every day, we would have to pick 5 people
Yeah.
that you could start on treatment. So those were some of the
And these are
things that were,
people you didn't know. You didn't know they
no,
were positive. Okay. This was okay. Go ahead.
because people
Wow.
would want to see the doctor and they want medicine. So they would just line up, we'd take their complaints, and then they would get their vitals taken. When they would take their vitals, then we would also test them for HIV. And then once they got to the doctor would know the results so that he could make
Hmm.
decisions about how they were going to be cared for. So that integration we found to be very effective. Even now, 2 years ago, we put a dental suite into our hospital because a lot of times men don't come for any other services, but they do come for dental services. So
Yeah.
we call those soft services, like disability care, wheelchairs, eye care. There's all kinds of soft services that you can use to build relationships. And in the process of building relationships, people trust you with other things.
Hmm.
And so that's kind of the approach that we've taken. But it's just comprehensive care.
Yeah.
They use the words human centric, person centric, and all these kind of words now. Well, that's really
Hmm.
always been our approach, is that
Hmm.
focus on what makes the person most comfortable and how you can build a relationship. I always used to say, let the patient set the agenda. So if they came and they have a rash, focus on their rash and take care of their rash first. Because once you do the thing that matters most to them and focus on that, you can then come in with a public health agenda knowing what the prevailing challenges are. But if you start there, you just won't win as many people. And obviously, we knew that in order for children to stop being orphaned, their parents had to stop dying. And so a big focus for us was delay of orphanhood at the beginning, is just getting parents on antiretrovirals so they could live to save their own children. And so I think if we look at the endpoint first and then back into the solution, it's much
Yeah.
easier if we try to start with the problem and move
Hmm.
to the solution. But if we try to say, what are we trying to accomplish? Oh, we want parents to live with their kids. So what are we going to
Hmm.
have to do to make sure parents don't die unnecessarily? So then you start backing into. So most of what we did was just to accomplish those kind of big goals,
Yeah.
and or they sound simple, but once you start to learn the culture and understand the stigma and understand how quiet and shy our country is and non-confrontational. And
Hmm.
people thought, if you, even during that time, people thought if you would touch someone who's HIV positive, that you will get HIV. So working through and understanding and journeying with the nation was very important. Not coming in like you have the answers, because you don't. You have
Right.
the answers in your American sterile environment where people drive their car to the doctor's office. They go sit in a waiting room with the fish tank, and then they
Hmm.
go back and they get in their little room, and somebody comes in, and most of the time they get every care that they need for the most part, really. Here, you have massive gaps in supply chain, you have low resource environment, you have all kinds of barriers and obstacles you're trying to work around. But if you don't have the trust of the people, you don't have anything. And
Hmm.
so those were really just try to take it day by day. Oh, okay, yesterday we tried this. It kind of worked, but we do think that we can dial it in and make it better. How can we make it better? And just those minor pivots every day, I think over time it did change the trajectory of what happened in Eswatini, although we never take credit for it. We were just some of the boots on the ground, working towards a better tomorrow. And definitely when it comes to HIV, today is better than it was in 2004.
Sure. Sure.
We're really grateful for
Hmm.
the investment from around the world in making sure that we had antiretrovirals. And, obviously there's been a lot of challenges in the past 20 years, but we no longer have, you were talking about coffins being, kind of front and center in the
Yeah.
vendor space when you were here. What I remember is that every weekend they would spend an hour reading all of the people who died's name on the national radio station. And there was an
Wow.
underlying fatigue that I noticed in our staff because funerals were always on the weekend and there's night vigils. So you go the whole night and you bury at dawn. And just because people couldn't get good sleep, because every single weekend they were going to a funeral. There wasn't a
They'd stay
weekend.
up all night and go to and they have the
Yes.
burial at dawn?
And they have the burial at
Okay.
dawn. And understand
Okay.
a lot of this is also manual labor. So they're having to dig the hole and make the food for all the people who come. There's a lot of work, physical
Yeah.
work that goes into doing this. Now, if you're doing that on Saturday, Sunday, Saturday, and Sunday, Saturday, and Sunday for weeks, months, years on end, there's an underlying fatigue that just is there that is very difficult to push towards a better tomorrow. And
Hmm.
so, being out of that and being in a different space, even though there's still challenges today, is real blessing when you reflect on it.
Yeah, wow. I'll just say I do remember when the light bulb came on as we were talking during one of our first visits. It was like, wait, so you're just really trying to delay orphanhood? You're like, yeah, all this other stuff is just we're just taking care of the people and building loyalty and stuff. But the whole point is that. But okay, well, cool. Well, I want to get into, fast forward to how it's developed. My mind was blown this last time whenever I went and saw. So my first time, I'm in my late 30s, go over there and there'd been some land and some ideas of this new, big center and everything. And I have a real problem with envisioning the future sometimes when it comes to buildings and things. I thought, that sounds great. It looks really pretty out here. But anyway, I went out there this last time and holy crap, it's like Disney World for healthcare people. And it's all these, and then we're going to talk about the oxygen tank thing. But I was literally chills. And when I went out there and I was with, Paul Rothwell and our group, and you could just feel the weight of something very, very special. And it was, it was, I get a little misty eyed just talking about it, but that was really something special. But I want to, and maybe I'm jumping a little too forward ahead here, but I do want to get into what we just talked about, how it evolved, and then in comes the whole COVID thing and how you guys dealt with that. Because that was my experience at that time. I was full time in the ER still, and so it was a special time to say the least. But it was had a very much different impact on you, and you really carried quite the burden of the whole country and had to innovate and do some things in a different way, especially and you go through the different waves that happen. But just kind of comment on that and tell me what that was like for you.
Well, you came in 2012, and we were staying just renting one house, and basically every space was being used for something different. And people would always come to the gate, and they would walk past the hospital and come to our house, and
Hmm.
sometimes they go, well, what about going there? That they didn't want that. They want to just come inside and go on the front porch and sit under the tree. And we would have bags, IV bags hanging off the trees and stuff like that in the yard. And then we just knew that we need a piece of land here that is our permanent
Yeah.
home. And so in 2013, we had been looking, and in 2013, the door opened in February, a piece of land that was 35 acres. And we looked at it on the 9th of February, and on the 11th of February, signed a contract. And then we sent a message out to our family and friends because we had not raised any money. But the owner had told us that if we pay by the end of the month, he'll give us a 10% discount. So we sent a note out to our family and friends and said, hey, God's opened the door for us to buy this piece of land. We really think that this is what we should do. And by the 6th of February, all the money had come in to buy the land. So literally, like in 17 days, we had our own farm in Eswatini. And
Mm-hmm.
that ended up expanding to about 200 acres because the next year we had a big drought and there was a river. There was a piece of land between us and a big river. We were able to, that was a second acquisition for us to be able to get that land so we could get access to the river, which really helped with water security. So now we
Mm-hmm.
have this 200-acre piece of land. It's farmland. There's only a small dairy barn on it, dilapidated dairy barn. And we just move down these shipping containers, a storage, and we start building. And that was in 2013. And in 2025, there's about 25 or 6 buildings there built.
Mm-hmm.
I mean, to me, it doesn't seem like that much, but I think sometimes I forget that you're just not objective anymore to what's going on. You're just like, oh, we've got a problem. We've got a building over here, or we've got enough, we have a building team that can build this, or we can solve this problem. And you're just continually trying to solve the next problem that's in front of you. And that ended up being 25 buildings. So we started and we never really built a building before a program was running. We would always be doing something in a small little space or in a warehouse or in the corner of somewhere, and then we would build to try to manage what was already operational. I don't know if that makes sense. And so that's kind of how the whole thing was built out. We have had our own construction team, local
Mm-hmm.
construction team. They've done an amazing job, really good quality, with lowest possible cost basis as possible, so that we keep most of the funds moving towards the patients. And then in late 2019, we started a cervical cancer program because there was the number one cause of death right now in Eswatini for women is cervical cancer between the ages of 15 to 49. So in response to seeing that at the hospital, we knew that we needed to start a cervical cancer program. And when we did that, we needed kind of a certain kind of infrastructure. So we finished a couple of buildings that we wouldn't probably have otherwise finished had it not been for the cervical cancer thing. At the same time, too, we started becoming the snake bite center of excellence for the country. All the snake bites were
Yeah.
coming to us. We wanted to start an ICU. So in 2019, that was what was in the hopper, is that you're
Yeah.
trying to solve the cervical cancer thing and the snake bite. How can we stop having people die from neurotoxic snake bites? So we built these 2 buildings, and they finished the first week of March 2020. Of course, in January 2020, the world started figuring out, oh, there's this thing called COVID. And
Mm-hmm.
so many things had happened, like bird flu and all this other stuff. It never came to us. It just never reached us.
Yeah.
So you can kind of think that was going to happen, but we all knew in our heart of hearts that this one was different. You could just feel it, and that it would come to us. So in March, the first week of March, we finished those 2 buildings, and the last week of March, our borders closed. You couldn't get anything into the country. You couldn't get anything out of the country. You couldn't get technicians in the country. You couldn't get engineers. You couldn't get anyone from outside of our small country inside. And I was just like in shock. God, why did we finish this for the cervical cancer program and the snakebite program? But now there's this major global pandemic that is brewing. I remember when I couldn't even talk about the fact that these buildings finished right before our borders closed because it was just surreal. And I remember about a
Yeah.
month after it happened, God just woke me up in the middle of the night and he said, I told you to build an ark. And that was even more surreal than anything else because I realized when he said that something crazy was going to happen on that campus.
Mm-hmm.
So it was also interesting because people couldn't move within 5 minutes of their homes because
Mm-hmm.
there were restrictions on us moving within 5 minutes of our houses. So people weren't even coming to the hospital for normal things. So we were slow at that time. We started paving the roads. We started planting trees. We started landscaping. We started doing all this stuff like, hey, this is white space you couldn't pay for, like let's use it well. So we did. We did a lot of things. When I walk around the campus, yes, COVID was really difficult, but it also brought some things to us that we would have never had otherwise. So
Mm-hmm.
our first wave of COVID didn't come until July, which was really New York was
Yeah.
December. So 6 months gap where you're just waiting for the bomb to drop, and
Yeah.
trying to make the best of the time that you can. So
Mm-hmm.
in July, the first wave came and it was more just learning about the disease. We did not have an oxygen shortage at that time. But when the second wave came in December of 2020, it was obvious within about 5 days of that wave starting, we were going to have a major oxygen crisis. Literally, Kevin, I called everyone in government. We had lost our prime minister to COVID, but I called the acting prime minister. I was like, listen, we're going to have a problem. I can already forecast it. I can see it in the data because we had this digital system, which was tracking all the data. I could see we're
Yeah.
using more oxygen than we were getting. Their demand was outpacing supply. He asked, well, what can we do? And I said, well, there's a few things, but the problem is you can't turn on oxygen production in a crisis. Once you're in a crisis, it's too late to fix the problem. So we started saying, okay, the second wave is going to be really tough because there's not going to be enough oxygen, but what can we do to prepare for the third wave? So our engineering team and our biomed team and all of our technical teams started working on designing an oxygen plant. In January, they started building it. And the building team that had built all those other buildings, they built the shell of that building in 52 days. It was crazy just to watch their grit, their resilience, their tenacity, never looking at,
And that
what
is
is this
no small, that's a large building. I've seen it.
huge
That's
building?
high quality. That doesn't, that's, we're not talking about a shack here.
No, it's a huge building and very nice quality construction.
Yeah.
And in on June 9th, we started producing oxygen for the first time in Eswatini's history because until that point, Eswatini was completely dependent on South Africa for
Yeah.
oxygen. So about 3 weeks later is when the third wave came in. And it was I believe it was twice as many people were hospitalized during that wave as the wave before. But it was totally different now because we had enough oxygen. Our
Yeah.
case fatality rate in the second wave was one of the highest in the world at 4.4% because we didn't have enough oxygen. In the third wave, when we had all the oxygen we needed, case fatality rate, the case fatality rate fell by half to 2%. So
What was
you
that like? I don't, the first, you've got people coming in, and we talked about numbers before and what that was like. That was tough. You've got people in there and you need oxygen. How did you
It
handle
was
that?
terrible. And you had to decide, what are we going to do because we don't have oxygen in the second wave? Are we going to push the people away? And it went back to
Yeah.
that, what I said was on our badge. What would I do if this was my mom?
Yeah.
Would I push my mom away just because I didn't have oxygen? No, I would take care of her. I would love her. And that's what we did in the
Right.
second wave. And it wasn't easy because, there were it's kind of interesting that most of the hospitals stopped taking patients because they didn't have oxygen and all the ambulances got directed towards us. And we decided we weren't going to push anyone away. And
Right.
then the propaganda started, why is everyone dying at TLC? Well, people are dying at TLC because of oxygen. I mean, from a
Yeah.
scientific standpoint, we could map that out and figure out what was going on. But public
Yeah.
perception was if you go to TLC, you die. And like, no, when you don't have oxygen, you die. If you don't have oxygen with COVID, you can try everything else and you're not going to win. So that's why
Sure.
we really believe that moving forward, we have to have oxygen. So the team put on this heroic effort between the second and third wave, got this oxygen
Hmm.
plant up and running. The
Hmm.
third wave was so different than the second wave. I
Hmm.
cried so much during the second wave because people were just dying. You couldn't stop it. You would beg for oxygen. You couldn't get it. They would tell you you're going to bring you 100 cylinders. They would bring you 6. I mean, it was really painful. I remember one of our board members saying, Echo, whatever you do, don't let the soldiers see the general cry. I would hide behind this building just so I could vent off the tears that you just can't. And I don't mind talking about it because it was a defining moment for us.
Yeah.
It was very painful, but we did not back up, Kevin. We did not give up. We did not retreat. We leaned
Hmm.
into the pain. And I remember I was talking about the digital system. About 7 years ago, we started building this digital system just to solve our own operational pain points. And I remember our senior engineer would come in PPE into the hospital, watch what we were doing, watch all our time in motion. He would go out. I would see him on the top of a trash can writing code on his computer. And 30 minutes later, we would be using these rapid response modules that he built for us. And we're still using them in our ICU today. So when you think about what happened in that pressure
Hmm.
situation, everything got given a pressure test. The digital system, our team,
Hmm.
there was so much that got given a pressure test, and we withstood the pressure test. So
Hmm.
that, of course, just gives the team so much confidence moving into other challenges. So then in the third wave, there was a philanthropist that gave us 55 new ventilators, like really good ventilators. And we already had some ventilators and we had all the oxygen we needed. And so we just started escalating care. We did not wait to escalate care. We escalated care. And it was so crazy to see that the people that you thought would live, they died. And the people that you thought would die, they lived. So if you were choosing because you lacked resources, so you had to make resource choices, we were going to choose the wrong people. I really believe the ability to escalate care uniformly and without bias allowed us to be able to see something we would have never been able to see before. And we were able to see that because of this heroic effort of this team that built this oxygen plant. Well, after the oxygen plant was built, people were coming from all over the world, coming to the campus saying, we want to see your oxygen plant. And I was like, well, it's just an oxygen plant. Why do you guys want to see an oxygen plant? I didn't know it was anything. I didn't know it was big. They said, don't you know it's the biggest PSA oxygen production plant in the continent? I said, no, I didn't know. Well, these are
In the
technical
continent of
people.
Africa.
These are technical people who know what they're talking about, and they would come in like, we see anything like this. This is the biggest plant. Oh, this is amazing. They were just, well, back at home, I didn't know that we were walking into an economic nightmare in that there's been a lot of corruption around oxygen supply over the years, and people have been making a lot of money off of it. And I didn't realize that our plant was now going to challenge the status quo.
Right.
There's a lot we could go into with the plant. This doesn't really matter. If you asked me if we would do it over again, we would. A lot of people's lives got saved. Has it been hard for us? Yes. Did I expect that we would build like one of the wonders of Africa and the whole continent and the whole world would see it for what it was? But at home, there's this tug of war between these other ulterior motives. I didn't know that was going to happen, but we did made the decisions that we made with the information we had at the time, and a lot of lives were saved. And one thing that no one can criticize us for is that we never gave up on trying to find solutions for the people, and people lived. I mean, there's people that still. I just was at the campus a couple days ago, and one guy comes up to me that was on a ventilator for 3 weeks. He's 65 years old. He's all excited. He's happy. He actually brought us 2 chickens for the birth of our granddaughter. That's why he was there. He saw it on Facebook. He brings 2 chickens. And then I saw the father of another guy who was on a ventilator for 2 weeks and lived. So, you just realize that those stories wouldn't even
Yeah.
be there if you
Yeah.
hadn't, and those families would still be grieving the loss. Obviously, people still died, but I just really felt that once the oxygen plant was built, once we had enough equipment, that even if the people were in Europe or the United States, they wouldn't have made it if they died. And that makes you rest with your head on the pillow in peace. And so it was definitely a ride, but it was a very defining moment for our organization. And
Yeah. Came out of the other side stronger.
Yeah.
What were you saying?
I just think it's something you can never erase. It's just part of who we are.
Yeah.
What everybody else gave, we didn't.
And you skipped over some stuff that, if I remember right, with all this going on, there was some real sacrifices on you and Harry personally that, and we can edit this out, but you guys, didn't you take out a second mortgage on your home or something and really?
Actually, we had finally in 2017 and 2018 built a home in Eswatini with cash. We just were always focused on taking care of the people. And then at some point we realized, before our kids graduate from high school, we want to build a house so that they have a place that's their home. And so we did that, and we had built with cash. It's really, it was our life's nest egg. And then when we got in the middle of COVID and the numbers were super high from patients that needed help and needed resources, and we just took a mortgage out on the house.
Yeah. So, yeah, you guys have made a lot of sacrifices that aren't very public that I think just kind of endear everybody to you that knows, but that's insane. I do want to comment a little bit. I know we're getting close, and this is like hours of discussion that we're going to wrap up in just a few minutes, but there's been a lot of, and you alluded to that with the oxygen tank place and all that, but you've had a lot of scrutiny, you've had a lot of pressure there's been threats against you and your family, and that hasn't been there before. This has been more recently over the past few years, and it has to do with, kind of the work you guys are doing and the good you're, doing to the company. And if anybody hasn't read the Washington Post article, they should read that. But there's a lot of, I've always thought if you're doing something right, you're going to get some pressure, but you guys have gotten a whole new level of pressure, which means you must be doing something really, really right. But kind of comment on that for a while. I know that's a big can of worms, and I've just given you a few moments to discuss it. But
Well, no problem. It's a little bit easier to reflect back now. I was telling one of our board members the other day, have you heard about the 5 stages of grief? Well, I am finally in the last one, acceptance. For anybody who's been around the last couple of years, you'll know I was in the bargaining stage for a long time. But the thing that I can say is that, during COVID, as I mentioned, we took care of 90% of the nation's COVID ICU cases. And we just leaned into the challenges and did our best to learn every minute of every day how we could do things better, how we could tweak things. And I really believe just being there for the people endeared us even more to the nation than maybe we were already endeared. And we were already very well loved by the normal people on ground level. Really did love TLC and knew that we had their back no matter what happened to them. Well, COVID just reinforced that. And then in 2023, we saw 300,000 patients in 2023, which was the most of any facility in the country. And all we were doing, Kevin, is trying not to say no to people. People would come with challenges. They would go to other hospitals. They wouldn't find drugs. Drug shortages has been a massive challenge for our country for a long time. And people would come and we would find solutions because we've always really focused on finding solutions for the patients that we're taking care of. And I had no idea that while we were in our own little world, just trying to take care of the next person, that we were going to challenge status quo. And, status quo has, as I mentioned, been hospitals without drugs for a long time. Obviously, that's very unpopular on the ground. And, I saw the trajectory, the number of patients we saw went up 300% in a 5-year span of time. I was watching the data closely. I was trying to flag it to the people that I thought needed to know about it, to try to do something about it, because obviously there's no business in this world, no company, no nonprofit in this world that can manage that type of growth without resources. And the resources were not going to us because we do not participate in certain behaviors that are necessary to get those resources, i.e., bribes and
right.
backhands and other things.
Yeah,
Was
it's
going
all getting blocked. All this money that's supposed to be going to people like you and should be
just
going to people like you is just getting blocked at the level of government due to you not giving bribes.
yeah. So and
Yeah.
I think other people understood that better than we did. It just wasn't in our wheelhouse. We had been making decisions in the best interest of the people for 20 years. We'd
Yeah.
never taken a penny for treating one person. I mean, we just really always tried to put the patient first and make decisions that were good for the patient. We just really didn't understand the depth or the level of evil that was under the surface until we got in the crosshairs. And then once there was this huge number of people coming to us, we started to become a threat without even knowing it. It
Hmm.
was as shocking to me to figure out and like kind of decode what was going on. Well, you start to figure out that the people you're threatening, their ways of doing business, are actually one of the ones who are putting blocks in the way of you getting resources. So here we are, taking out loans on our house. We are using credit lines for TLC. We're taking out our retirement to pay salaries. We're doing all kinds of things, thinking that once people see the data, something will change, resources will start flowing our way, and it just didn't happen. And I have to be very clear to say it is a small group of people. It is a small group of selfish individuals who are looking out for their own best business interest. A large majority, to the highest level in the land, His Majesty and the Queen Mother, are fully supportive of our institution. They love TLC. And I know that. And so it gives you confidence to take the next step for the next day because I know that the majority of the country is supporting us. Now, the people who feel like they might lose their revenue stream because something is done more efficiently or more effectively or without the same rules of engagement that have ruled the roost up until now, we just operate differently. I'm not scared about a thing they're going to find financially. They can look till I die. There is
Right.
nothing that they're going to find where we have, misused funding or anything, but that's not the norm. The norm is that funding is diverted, funding is misappropriated. And so when we started to realize that, oh, we're challenging the status quo, and status quo is not happy about that. And then they started to do interesting things like come and try to do business deals with us. Well, the fact that we told them no made us even more in the crosshairs.
Hmm.
So, the last couple of years have been filled with some challenges that we probably never anticipated. On the flip side, again, the harder they try, the stronger they make us. And that's just what's happened. Our team is held together. They've been resilient. They're determined. I can't tell you the number of people who've come and tried to offer us, huge amounts of cash for the campus. Like the campus is not for sale. That place was built as a beacon of hope. This is a place of healing. This is a place with a mandate, a mission. We have family and friends who have helped fund build the buildings. None of those buildings have been built with any government funds at all. Whether US or Eswatini government funds have built that campus, it has been built by private citizens from the United States and Canada. And they trusted us, Kevin, to
Hmm.
carry out the mandate and carry out the mission and vision of this institution. The last thing we're going to do is to turn around and sell it. It doesn't matter how much money they offer us. But that oxygen plant, they want that thing. They're jealous of that oxygen plant. So once I started to understand, oh, this is the motivation behind this is why things are not moving or flowing the way they should. This is why there's no logic in the decision making, is because it's intentional to block. Then of course we had to make operational decisions, which is we're not seeing as many patients now and we're doing things differently than we did before. We're working on what does the funding model look like moving forward with the shifts in global aid, of which we were heavily funded by USAID? What does it look like when that pillar's not there? And for
Yeah.
us, there were things we knew we needed to do 2 or 3 years ago, but we were seeing 1,000 people a day at our hospital. That's a lot, no matter where you are in the world. Definitely in our
Sure.
environment, that's a lot. So we've now used this period of not seeing as many patients and having to say no to people, which we never have done before, to be able to work on standing up new pillars under the stool. So, one of the things we're doing now is we've turned on revenue generation activities because moving forward, we don't want to be dependent on any one government or any two governments for funding or any funder for that matter. We need to be generating some of our own revenue so that we can stabilize the base. And my goal is to be able to turn on enough revenue that we can pay salaries because salaries in the past year have been very difficult for us. I don't want that to
Hmm.
be difficult moving forward because if you can secure your human capital, then your coast is clear, really. You can work through about anything if you secure your team. But we've struggled for the first time ever to pay salaries in the last year. So, the pain has, of course, forced us to pivot and to do things maybe we wouldn't have done if, for instance, global aid cuts didn't happen. But we are trying to embrace it, learn,
Yeah.
grow, change, not change the heart and soul of who TLC is, but the funding model can look different moving forward, and we can still continue to love and serve people in Eswatini
Hmm.
and beyond. We're doing more work outside of the country to diversify where we're doing work, especially around the digital technology and some of the other innovations like the telehealth hubs and the drones and other things that we've done. We're working with other teams that are outside the country, and that gives more diversity. I really had to reflect on this around the time of the Washington Post article, but it's really important for us not to let one political moment define the institution. If we let that happen, it's our fault. So just because there's this small group of people who want to control the health sector in Eswatini for their own personal gain doesn't mean that we have to let that define our institution. and it won't. And, I look forward to us continuing to develop and push into something that's more diversified. I'm very grateful for the funding that we received for 15 years from the United States government, from the United States taxpayer. It was pivotal. It saved a lot of lives. We were able to do a lot of good with that funding. I know that we expended every penny in a way that honors the taxpayer.
Mhm.
But I don't want to begrudge what we don't have now. I want
Mhm.
to celebrate what we had for 15 years, where it took us, and what now takes us the next 15 years or the next 5 years. We're going to be arms wide open to figure that out and hearts wide open to figure that out. And really, it's just about solving more problems. And that's, I think, what we've been working on for the last 20 years. I mean, when you came and you saw us in the middle of nowhere and we were all mobile at the time, we were just solving little problems. Maybe the problems are a little bit bigger now, and a little more complex. But we do believe that there's solutions, and we're going to continue to work for those.
Yeah. You know, speaking of finding solutions and everything, we're not going to have time to talk about it, but this Lavello thing, your model, there's been people wanting to expand that throughout the to other countries, which we won't have time to get into very much, but that's pretty exciting that this model you developed over the past 20 years, essentially in the making, other countries see that and want to incorporate that, which is, I think, exciting.
It's very exciting. And if everything was just smooth sailing in Eswatini,
Hmm.
we wouldn't. This is our first love. We love
Yeah.
Eswatini. We love the
Yeah.
people we're taking care of. But at some point, I had to realize that God is the God of 8 billion people, not 1 million people. And if I let his boundary lines or border lines be defined by the country he first planted us in, that is probably not his plan for us. There
Mm.
is something very special that has happened between the team and team unity by which our team operates. They're just different, and everybody knows it. There's nobody who comes on that campus who doesn't comment about the fact that this team is different. What have you done to get this team the way that it is? And we've started to write about that and
Hmm.
try to decode it, because other hospitals want to take this template and use it. And then when you
Hmm.
take the digital system, which is, it has four pillars: supply chain, productivity, HR, and service delivery, which in our case is healthcare. You
Hmm.
take this, which basically integrates, and there's no silos because everything's fully integrated. It has just completely revolutionized our operations, but it wouldn't have happened if the team wasn't prepared for it. So it's this combination of these two things together that really brings out something that I mean, Kevin, asked to speak all over the world about
Hmm.
what happened here during COVID and all the other things that have happened, and how the team has stayed so unified and so resilient. And sometimes people focus on the digital technology, but they can focus there for a few minutes. They're going to start to realize that it takes this team that is just
Hmm.
different than what is happening in the majority of the hospitals in our environment. And now in other countries, they want this model. And
Hmm.
so part of the slow time for us now of seeing patients is being able to articulate this in a way that is transferable and
Hmm.
scalable. And so we're excited about that, because maybe God has more of a plan for us than to just care for 1 million people. Maybe he wants us to be impacting several million people, and we can't do that if everything is really calm and cool at home. You'll just stay comfortable. So yeah, it's a little bit uncomfortable, but and there's changes and pivots we're making, but the team is really excited. And you know what I'm excited about? I'm excited about them. There's talk of using the Miracle Campus as a training center for other
Hmm.
teams to come in and see this model in action. But then I believe the most important thing is that you send people who have executed this model to the other sites to do a side by side journey as you implement this in another location. I'll be thrilled when our staff are getting on airplanes and going out into the continent and changing other nations. And so, as painful as the last 5 years have been, listen, they've tried to say they're going to kill me, and they went beyond that. They say they're going to kill one of my kids. That
Yeah.
that hits you at a place where it was fine when they were talking about me. I'm not really scared when they talk about your
Yeah.
kids. So there are things that you could have quit. There are things you could have given up. But to be frank with you, the challenges have just made our resolve even deeper, and stretched further than it probably would have ever had we not been challenged in the way or had the challenges that we've had. So we're trying to embrace it. And as I said, I'm really glad I'm in one of the later stages of grief, because when we had to start saying no, when we had to start saying no to patients, that was really painful for me.
Yeah, I remember. Yeah, last time we were there, I mean, threats were happening and stuff. And you hopped in the car with us as we were leaving your house just to hang out with us some more. And I guess you kind of got in trouble because one of the bodyguards didn't know or telling certain people, and you just kind of rode in the middle. And I was like, this is insane that, you've got to pay attention to this. So I don't know. I just, that's just crazy. I will
When
say,
they threatened one of my kids, I went to him and I said, listen, this is a situation. And he said, Mom, let's focus. This is just a distraction. We have work to do.
your
And I was
kid
like,
said this.
yeah. I was like, he's 23 at the time. I was like, all right,
Yeah.
you're right. Let's focus. This is a distraction. We have work to do. And it doesn't mean that you're, you know, don't don't just take normal precautions or be careful, but we do have to focus, and we have to not be distracted by
Yeah.
the noise that is not in the best interest of the people.
Yeah. One other last little question I have, and I've kept you longer than I should have, but with all this stuff going on, and you said you went through all the stages of grief and all that, how do you recharge your batteries? How do you kind of keep the energy level up? How do you do that? You guys have a lot, you have a lot of support throughout the world, but yeah, speak to that a little bit and
Well, I
some of
got a
your
guy
thoughts.
in my house that also has a hairdo like yours.
Harry Vanderwal. He's the
That
man
is
behind the curtain.
been treating me like a queen. For we married 28 years on the 29th of June, and
Yeah.
he's quiet but so steady and centered, and he just he takes care of me when I'm full out, full bore firefighter, intensity. I love the intensity of what we do, but yeah, it takes a lot out of you, and he makes
Yeah.
sure that I relax. And okay, my hair, he does it. I mean, he takes care of me, okay, in a way I can't explain to you. So I'm really grateful for that. And we really, really, really have had really good relationships with our children, adult children.
Hmm.
Our family has been just a joy. We've had such a great time together in this journey. And we have really, really strong support system through the staff that work for TLC. I never even thought it was possible to work in an environment like this. There's just such a support. You don't have to, build walls or hide things. You can be authentic, genuine. When you're not feeling well, you can say it. When you need a rest or a break, you can say it. So that environment really does help you to recharge, because you don't have to kind of hide behind your little curtain of perfection. And so I'm really grateful for that. And, you just, there's been times where it's been difficult for me. Again, when I talk about having to turn the patients away, that is literally the hardest thing that I ever, sorry, that
Sorry.
has ever happened to me, saying no to patients. But I, even during that period, it's just like, being able to lean into the pain and being with a team that it's okay to be in pain, and that they're going to be there for you on the good days and the bad days and the every day. It changes the way that you process difficult things. And so, and I mean, we've been really blessed. We've been really, really blessed with a very
Well,
fulfilling life.
yeah. Yeah, it's been a real pleasure to see it over the years, and I can't say enough. So if anybody ever has a chance to go out there and check out your show, that's absolutely incredible. I can't say enough. Unless you see it, it's really top tier, state of the art, and you've just come a long way from the whole deal. I mean, it's a movie. This is an Oscar winning performance. Somebody needs to pick this up at some point.
Hopefully
So
you'll
how
be
do you
part of it.
people?
Hopefully
Yeah,
been a fun ride, and it's exhilarating, and we don't want to do it ourselves. We do need more people to come on the team. So maybe your voice can
yeah,
be part of it.
yeah. Well, it's funny you mentioned that too. One of the things that I talked about you initially is like, what do you need? It's like, I just need support. We need to have connections. We need, people join with us, and whether that's financially or not, just having those connections, because to not feel like you're an island or anything. And that's of course developed as well. So how do people find you? You know, we've got the lootcommission.org. What are the best ways for people to kind of connect, follow your work, and that kind of thing? What do you recommend as I
Well, feel free to go to any of our social media handles. We've gotten better at that. Did not used to be something we focused well on, but we've gotten better at
yeah,
that. So you can find
yeah,
us on the social media platforms. You know, it used to be a waste of time. Then I realized it wasn't a waste of time. So you
agreed.
can also reach us at info@lootcommission.org, info@lootcommission.org. And we just would love to shout out, one of the things that we're doing is trying to reignite the grassroots level base that got us here and got us
Hmm.
going in Eswatini, because there was a period there where things got so big, and we were really, being very heavily funded by the United States government, that I think the grassroots level team didn't know where they really fit. And so we started this new campaign called Take 10, and we really would love if you would go to our webpage. Just right on the homepage, if you go to it, it will talk about the Take 10 campaign. And it's real simple. Take 10 minutes to learn about TLC, give $10 a month, ask 10 of your friends to do the same thing. And we really feel that if we can continue to grow this grassroots level base, that we'll be much more shock absorbent in the future should something similar to the global AIDS cuts that happened in January happen again. That we see this as a move, we call it from nation to neighbor. It's been the United States government that has taken a big portion of funding for us for many years, and we see this moving to the neighborhood. And if a few people don't give $10 a month, you have 50,000 people giving $10 a month, and a few don't, you won't really notice that as much as losing one big donor as we did in January. So those are some of the things that we're working on, and we would really appreciate if everybody would just kind of take that to their circle of influence and see if it's, I think it's about one Starbucks coffee a month. The website is just lootcommission.org, which you can also find a contact page there to us as
Okay.
well. But yeah, reach out
Okay.
to us, and we'd love for you to, as others say, join the vortex. Many
Echo,
years ago, somebody started saying, whatever you do, be careful. If you get close to Loot Commission, you'll get sucked up in the vortex.
that's nothing more true. Echo, it is a pleasure. It is so good to see you. It's like a warm cup of soup that it's just great to see you. And please hug your family, hug that handsome Harry for me.
Thank you
It's
very much.
funny.
And
Yeah, he's,
thanks a lot.
yeah,
And
yeah,
feel free at some point to bring on some of the people from our Luvelo team, under the chief technology officer, or some of the other team, because I think that would be a really rich conversation. They can talk a lot better about it than I can. But yeah, it's been a
sure.
real blessing to have. It's a total leapfrog game changer, Luvelo, which you will not be surprised means compassion in Siswati.
Yeah, that's impressive. We didn't have enough time to talk about that, but that's phenomenal. So I'm so excited about that for you guys. I'm excited about the future, where you guys are heading. So anyway, thanks for being you, man.
Thanks a lot, Kevin. We look forward to seeing you. Hopefully, we'll see you in a couple months.
Absolutely. I'll look forward to it. See you
All right.
guys.
Thank you very much. Have a great day.
All right.